Medical cannabis coaches are a new role in the cannabis industry. You know how when you go to a bud tender, they're not really allowed to give you any recommendations regarding to medical advice or medical efficacy of cannabis or anything to do with the medicine and the medical side? That's where medical cannabis coaches come in. We are the ones that bridge the gap between the doctor prescribing the medicine for the patients and the patients who don't want to learn the encyclopedia of cannabis but just want the benefits. What a medical cannabis coach does is very simple but very complex. We're taking the role of the thinking and matching partner or co-pilot for this patient, working alongside them to find their path, to find what it means for them to start low and go slow, what actual dosing they need to get benefits, what strains are matching to their own needs, what means of consumption is right for them, and so much more. After we build this baseline protocol for them, we're holding their hands and going through the journey hand in hand for the first 6 months, taking them from point zero of total confusion, not knowing how to start a medical cannabis treatment, to point B, which is getting the maximal relief they can within the 6 months, not necessarily only for the indication for which they've been prescribed medical cannabis, but also for other indications and other symptoms that they may suffer along the way. We're looking to help the patients regain a real life of a human. We want to help them reach a lifestyle that is as close to what they're desiring, getting them to really feel the benefits and the relief from whatever they're suffering from, keeping and maintaining the side effects at bay, reporting and doing the right journaling to how to report back to the doctors so that the doctors feel that they're doing the right thing, prescribing them cannabis and taking it as a serious medicine, not as this thing that, you know, stoners come to ask for. All of this is what's really the job of a medical cannabis coach. Now, we do see a lot of this transition coming these days because of the transition in Europe, and we see about 1 million new medical cannabis prescribed patients in Germany. We see that other countries are picking up the pace. And we see that in the USA, we just had it signed. We don't have it finalized yet. The rescheduling of medical cannabis from Schedule 1 to a Schedule 3, which means we can now finally talk about it to the patients. We can teach them. We can talk about the medical benefits of cannabis. We can share all of the research and all of the anecdotal experience that we gathered through the years. In Israel alone, we have right now 140,000 patients prescribed with cannabis and getting it from the pharmacies monthly. When we started out, we had 7. It's been a journey, but today we know what patients really need. And I'm teaching it to other coaches so they can help other patients because there's only one me and my capacity is really limited. So please come and check out the Medical Cannabis Coaching Masterclass, the Wisdom Circles Masterclass on my page. You're more than welcome to ask me questions about it and leave me a DM if you want to hear more or just contact me on the page. Either way, I'll be glad to answer questions about it.